Connective tissue mobilization is a technique that I use in the clinic all the time to help break up the fascial layer that exists underneath the skin but on top of the muscles. This fascial layer, think of this as like a spiderweb matrix that surrounds your entire body, kind of like saran wrap. It's this spiderweb matrix that helps all of the arteries and veins and nerves, that helps everything to glide more efficiently through the different layers. But sometimes when patients are having pain or any kind of urinary symptom or bowel symptoms, constipation, all of the muscles become hardened and tight and spastic, and in conjunction with that, the fascia also becomes tight and hardened and restricted. And so I use connective tissue manipulation in the clinic all the time, and I prescribe it to patients at home to do on themselves so they can supplement what we do in therapy at home at the clinic. And the way that I have patients do that is a form of cupping, and it's called dynamic cupping. And so I use this is the brand that I use, but these is what the cups look like. They're little silicone cups that are pliable and squishy and stretchy. And I'll show you how I use them here in the clinic and how I often prescribe for patients to use them. So to start, you're gonna wanna make sure that you have a few pieces of equipment. Not essential, but, well, actually, the essential pieces are that you have these cups. Not this specific brand, but you can get any kind of cup all over the internet. If you want something that's squishy, pliable, silicone, they're the easiest in my opinion to use. You also just want any kind of lotion. Doesn't matter what type of lotion. This is the type that I use, but just any lotion that you have available or massage oil is also fine. I also have a bolster in the clinic that I put underneath patients' knees. This is important because it helps to offload the knees and take any tension. It helps to take tension out of the front of your abdominal wall if this is the area that we're working on. So I'm gonna go ahead and get.
Okay, so for connective tissue mobilization that you're going to do on yourself, you obviously want the skin exposed. So I have patients do this a lot on the abdominal wall. A lot of the nerves that go down into the pelvic floor that can contribute to urgency symptom or bladder symptoms or pelvic pain symptoms, penile pain, clitoral pain, vulvar pain, scrotal pain, a lot of those nerves come out inside the abdominal wall or just below the abdominal wall. You've got these little holes in the abdomen called your inguinal canals, and a lot of the nerves that go down to the genitals travel through this canal. So you want to be able to get to those. And to get to those, you need to have the skin just above the genitals or just below the pubic bone exposed. So I'm going to come down here and make sure that all of this tissue, my pubic bone is right there. You want to make sure that all of this tissue is exposed. So I'm going to get all of my supplies. One thing I forgot to mention is a towel, a little hand towel. Because sometimes if you make this a slip and slide, the cups don't stick as well. So when you get your lotion, so I got my cups, here's my lotion. You want to make sure that the skin is well lubricated while you're doing this. So you see I just got a big glob of lotion. You're just gonna rub all over. And if you've got hair on your stomach or in the pubic area, if there's a lot of hair there, you're gonna wanna use more lotion than not. The more lotion you use in the hairier areas, the better the cups will stick. So just getting everything all lotioned up here. So I like to tell patients go from rib cage all the way down to pubic bone. This square is fair game to work. And even down here in the obliques, all of this is fair. So now that we've got all of that, you're gonna get your cups. And I like these silicone ones because they're squishy and pliable, and you can control how much tension you put into it. So the more that you squish this, the more that you squeeze it, and the deeper you press into your stomach or into the skin, the more intense the suction will create. So you're gonna squeeze, so grab onto the top, squish it in sideways, and then push down onto your skin. And that should create a nice suction, a nice vacuum here. Let me see if I can change the camera angle so you can see here a little better. Right there. Okay, so you have this nice vacuum. So you're going to start and just start gliding all along this tissue, all along the abdominal wall, and finding areas where it just feels a little stuck or a little tender. Depending on how tight the muscles are and how restricted things are, this may feel not comfortable. So give yourself some grace, be gentle on yourself. Anywhere that there's a lot of bone, the bony prominences, you can see that it just fell off. The bony areas are a little harder to mobilize, but especially down here in the lower abdomen, just above the pubic bone, that's where a lot of compression tends to happen. So you really want to work in these areas right over top of the bone to try to get things to loosen up a little bit. So right here over this bone right here, this hip bone tends to be pretty crunchy. You can see it fell off again, but you just want to keep, every time it falls off, you just pick it up, pinch, suction, and go right back at it. Trying to get into all of these crevices where things just aren't gliding or moving well, where things just feel kind of stuck. And in areas where it gets a little painful, you know, I call this dynamic cupping, but you can also just do static cupping. So right here is an area that just doesn't want to move. So I'm going to let it sit there for a little bit. You can just let it recruit some blood flow up into this area. The whole goal of this is this is kind of like giving your fascial layer a deep tissue massage. You're just trying to break up all of this fascia in the abdominal wall so that the nerves and the blood vessels can travel a little bit more freely with less restriction. So I'm directly over my pubic bone. I'm going to check over on the other side. Cupping is great for, you know, there may be some benefit to different conditions like IBS or constipation. You can do different techniques like the ILU or the I love you bowel massage. If you've got constipation, this can help kind of get things moving, may help get things moving. So you're going to start on the left side. So I'm on the left side of my body. I'm going to put it directly over my left hip here. And then you're just going to pull across over towards the center. And then do that a couple times. Pull over to the center and then lift off. So to lift off, you just squeeze and pull it off. Pull over, give a little lift to it and lift. And then you'll come up underneath the rib cage here and stroke down towards your pelvis. All the way down. Do that a couple times. Get blood flow moving. Get all of this fascia to break up. And then you can connect these two. Come back to the top, stroke down, and then pull over towards the midline. So you're making an L. All the way down. And then now you can start on the other side, because to come from the right side. You stroke up, all the way underneath the rib cage, get to the top, pull, stroke to the left side, and then stroke down back towards the pelvis and over towards the midline, like so. If you've got different pain conditions, I tell patients really try to focus down here around the nerves, all around these inguinal canals, trying to free up all along the abdominal wall, all across the lower abdomen, all the way even over here to these obliques. This hip bone, you can see on me, take the cup off for a second, I want to let the blood kind of recirculate. This hip bone here, the nerves that go down to the genitals, some of them travel along this hip bone, around the flank, all the way up into the low back, into where they attach into the lumbar spine or the sacral spine. So the low back and the pelvic floor are intimately connected. And so when you're doing this fascial release or this skin rolling or this cupping, I always tell patients, give these flank, the love handles, if you will, give them some love. Work all the way back here. Work back to front, up and down, side to side. Make little circles. If you lose your section, just reconnect. Anywhere that just doesn't feel like things are moving, or if it feels a little bit more achy or a little bit more tender than other spots, hang out there. The pack that I send or I recommend for patients comes with a set of 4 cups. So while you're letting one sit, there's 4 different sizes. So this is the 3rd size. This is the largest size. This you can be used on like the legs or the butt, but I usually stick between the 2nd size and the 3rd size. This is also a smaller cup that you can use in smaller areas. People that have a lot of perineal pain, I have them use this sometimes underneath the scrotum and above the anus or in between the sit bones, just to help free up that fascia as well. But for now, while we're letting number 2 sit, we're going to use number 3 to mobilize some other areas. So again, I just did it without even thinking. You just squeeze, get that suction, pull over, really just try to explore your body. Find areas that don't feel great. Give them a little love. Try to break up as much tissue in there as you can. It's worth noting that you may bruise. It's possible to give yourself a little bruise with doing this, especially if you do this technique, the static cupping. If you just let it sit, it is possible to bruise yourself. You're not causing any long-term damage. You're just recruiting new blood flow up to those areas. So, play around with this, explore your body, find areas that don't feel great. I'm showing this on the abs, on the abdominal wall, but you can do this over any crevice of the body, any part of the body. I'll have patients do this on their inner thighs. I'll have them do it in the perineum, just underneath the scrotum or above the anus in between the sit bones. I'll have people do this on their low back, on their glutes. Anywhere that, while I'm working on them in the clinic, using my hands, I feel that the tissue is pretty restricted and just doesn't want to move. All of those areas are fair games to throw some cups on and try to break up all that tissue yourself. This is something that, I personally don't recommend patients do this every single day. It's kind of like you wouldn't go get a deep tissue massage every day. Your body needs time to recover and recoup. So I tell patients, 2 to 3 times a week, 10 to 15 minutes, just spend some time finding areas all over your abdominal wall, your inner thighs, wherever your therapist or you're feeling pain, wherever those symptoms are existing. Spend some time exploring and seeing if you can break some of that tissue up. When you first start doing this may not feel too great. You may just have to stick to the static technique for a while until it starts to calm down. But eventually, hopefully, you'll get to a place where, whether your therapist is doing this or you're doing it to yourself, you'll get to a place where you throw these cups on and you're like, I don't really feel a whole lot. It just kind of feels like pressure. It doesn't feel too tender anymore. And that's the ultimate goal. That just means that there's enough blood flow, the nerves aren't super restricted, everything is moving and grooving the way that it should be. So, give this a try. Let me know what you think.